Have you ever wondered why our tears stay salty? That's because they contain water and sodium chloride, the same compound found in table salt. Now, imagine if all the water in your tears disappeared, leaving behind tiny salt crystals. These crystals would feel like sandpaper scratching your eyes. This is the daily reality for people with dry eye disease, a condition that makes simple tasks such as reading or driving become incredibly uncomfortable. Dry eye disease occurs when your eyes do not produce enough tears or the tears evaporate too quickly. In mild cases, it can easily be treated with artificial tears, but in more severe cases, it causes inflammation that clouds the clear front part of the eye, known as the cornea, leading to a blurry vision. Dry eye disease is also one of the most underdiagnosed eye conditions, yet it affects over 30 million people in the US alone. That means 1 in 11 people in this room may be living with it right now. My research focuses on understanding dry eye disease and discovering new treatments to manage it. In my project, I reviewed several drug candidates that had anti-inflammatory properties. Fortunately, I found a promising candidate, codenamed LC100, a naturally occurring amino acid in our bodies that helps with energy production. Now imagine you had blurry eyes, just like in this slide. The parent can barely see the face of the child. That is the problem that we are trying to tackle. I then asked the question, could LC100 reduce inflammation and restore tear production in dry eye disease? To find out, I developed a dry eye model using special eye drops on mice. I then confirmed they had a disease by doing 2 experiments. One, I measured the clarity of their eyes with an advanced microscope known as the slit lamp. Mice that had dry eye disease had more cloudy eyes compared to the healthy mice. Secondly, I measured tear production with a simple but effective method, using a dyed cotton thread that changes color when in contact with tears. Hence, the more tears produced, the more the dye on the thread would change color. I found that mice with dry eye disease had less tear production, just like the human patients. With a successful model created, my next step was to treat these mice with LC100 eye drops. My results were exciting. Mice with dry eye disease had 80% improvement in their eye clarity after LC100 treatment. Similarly, their tear production increased by 42%. These are great findings, suggesting that LC100 could be an effective treatment for dry eye disease. With LC100, we are not just treating the symptoms, we are working to create a future where dry eye patients, just like the parents in this slide, can once again spend more fulfilling times with their loved ones without pain or discomfort. Thank you.